The COVID-19 pandemic has positive and negative impacts on different aspects of lifestyle behaviors. Negative lifestyle behaviors associated with an increased risk of adverse outcomes from COVID-19. While dealing with COVID, we overlooked the fact that people's lifestyles were severely disrupted. Many people have become physically inactive and have developed irregular eating patterns, which leads to an aggravation on lifestyle diseases. COVID-19 pandemic has also caused significant changes to work, life balance and management of stress. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetic epidemic and heart diseases. Beat Diabetes Myths and Facts will help a large number of people to prevent or better manage metabolic disorders. Today we have with us experts to share with you advice on leading a healthy life. Let me introduce the panel to you. We have with us Dr. Sonia Puri, MD, FIM, SA, FICN, PGD, HHM, Associate Professor, GMC at Chandigarh, Dr. Navneet Agrawal, MD, PhD, FCCP, FIACM, Diploma Diabetology, Founder and CEO, Chief Diabetologist, DNA Sugar Clinic, Gwalior, and Dr. Subhash Chandra, MD, DM, DNB, FACC, Chairman and HOD, Cardiology, BLK Max, Super Speciality Hospital, Delhi. Thank you so much, doctors, for joining us today. Dr. Puri, we're observing that there is an increase in new onset of hyperglycemia lasting months after recovering from the COVID-19 infection. What are the reasons? Which type of diabetes is COVID-inducing? Is it temporary and can it be reversed?
So thanks, Ambika, for starting this whole talk with very nice question because I think most of us, we are not aware that the COVID pandemic that has ravaged the whole world and also given birth to many the long-lasting health problems, including a wave of newly diagnosed diabetes. Various researches they have been done, and one very good study that was published last year in Journal of Diabetes, Obesity and Metabolism that 14.4% of the COVID patients, they had diabetes, and that was newly diagnosed. Various theories they were propounded, but the most plausible explanations were that either the patients, they had pre-diabetes and they were not aware of it and they got diagnosed while they were getting treatment for COVID in the hospitals. Another was that, the COVID spike proteins that attached to the ACE inhibitors of the insulin cells and destroyed them, that led to the destruction of insulin and causing hyperglycemia or the increased blood sugar levels in the body. So it was immunity related. And the steroid therapy, which was used in the management of COVID, that also led to the surfacing of this diabetes sooner. So another theory was that maybe, the COVID virus that had spike proteins that attached to the ACE inhibitors of the beta cells of the pancreas and destroying them, and the steroid treatment which was used during the management of COVID led to the mushrooming or led to the surfacing of this diabetes sooner. So now it's too early because COVID is an evolving disease. So it's too early to label it as a type 1 or the type 2 diabetes now. Type 1 diabetes is the one which is insulin dependent. You need insulin throughout life. And the type 2 diabetes is the one which is insulin resistant. That is, the body is not, getting affected by the insulin. This newly diagnosed, why it has been christened as the COVID diabetes and not type 1 and type 2, because, the symptoms in it are entirely different from type 1 and the type 2. Like in type 1, we need the insulin throughout the life, whereas in these patients, when the diabetes was diagnosed, it reversed also. And so the insulin was not needed. So in this point, it differed from the type 1. And whereas in the type 2, the amount of the insulin resistance which was found, it was far less than what it was needed in the COVID diabetes. So the physicians, they had to use a large doses of insulin to manage sugar levels in this. So, it is too early to say, or to say that whether it should be type 1 and type 2. So that is a new diabetes that has been followed by the COVID infection.
Okay, so we're just going to come that. I mean, you're explaining it really well. Dr. Agrawal, like Dr. Puri was telling us about the type 1, type 2 diabetes, how COVID has affected it. Post-COVID, even the work from home culture is causing people to eat more, exercise less. What are the ramifications of this on diabetes management?
People eat whatever they have at their home, and Because of that, there is a risk of weight gain, and this weight gain can lead to diabetes in the patients who are non-diabetic previously, and in fact, in patients who are already diabetic, this might have increased the level of their blood sugars and making the diabetes control difficult. So the advice for these people, like those who are doing work from home, they should reduce 3S: reduce salt, reduce sweet, and reduce stress. And they should follow 20-20. Every after 20 minutes, take a break of 20 seconds, do stretching, and blink your eyes for 20 minutes, 20 seconds, 20 times. So basically, like if we advise the patients who are doing work from home for improve or increase the physical activity in the morning, evening, whenever like they are free from their work, that will reduce the risk of developing weight gain or the diabetes.
So I think key what you said, work from home is also of course 2020. That's a very good point which you've pointed out. Dr. Chandra, COVID-19 causes viral pneumonia and additional extra pulmonary manifestations as well as complications. What are the intermediate and long-term consequences of COVID-19 infection on the cardiovascular system?
We knew that the patients who had pre-existing coronary artery disease, hypertension or diabetes were the ones who were affected more by COVID, and they suffered subsequent complications. Now, after these COVID patients had recovered, a lot of them had faced intermediate and long-term consequences, and they were largely in the form of chronic fatigue or some kind of palpitation or tachycardia, what was called as POTS, postural orthostatic tachycardia syndrome, in which if a patient gets up from lying down, they have disproportionate palpitation or heartbeat, and we had several remedies to treat these symptoms. There were arrhythmias also noted, especially in the people who were going to gym or were athletes, and so much so that some of them, because of the over-enthusiastic exercise resumption, has had sudden cardiac arrest. So such were the long-lasting impact of the recovered COVID. And as we know, the very pathogenesis of COVID is causing clots in the vessels, and these clots could lead to spontaneous heart attacks in people who are apparently healthy, or leading to stroke or venous thrombosis or various kind of other peripheral vascular disease. So such were the long-term consequences, and these patients are typically called as the long haulers. That means their symptoms were lasting beyond 50 days after the recovery of COVID. So such were the large and long-going ramifications of the COVID after their recovery.
Dr. Puri, while we've understood, what the consequences really are on the cardiovascular system, the key to diabetes management is to keep a check on blood sugar and keep control of it. What is an extended version of the ABCs of diabetes? Can you tell us about that, please?
Yeah. So ABCs of the diabetes is as A stands for HbA1c test. Now that is the blood sugar test that tells the average blood sugar levels in the past 2 to 3 months. B stands for the blood pressure, and that has to be maintained less than 130 by 90 millimeter of mercury. C stands for cholesterol. That is having a check on the cholesterol levels, and as we know, there is a good cholesterol, there is a bad cholesterol, and the good cholesterol should be around 50 in women and more than 40 in men. And the bad cholesterol, which gives rise to strokes or the cardiovascular problems, that should be in triglycerides and LDL levels. Now, triglycerides should be around 150, and LDL should be less than 100. And coming on to the HbA1c test, to enlighten it more, its level should be 4.5 to 5.6. That is considered as normal. If it is 5.7 to 6.4, we say that the person has pre-diabetes, and if it is more than 6.5, we say that the person has diabetes. So our effort in both the diabetics like type 1 and the type 2 is to keep the level less than 7%. The reason behind this is that it leads to delay in the onset of complications. And the S stands for to stop smoking. Yeah. Now, some of the diabetes associations, they have further elaborated it into A, B, C, D, E, F. And D stands for diet therapy or drug therapy. And E stands for exercise or the eye examination. And F stands for the foot examination that should be done every yearly, or the eye examination every yearly or 2 years. So this is the mnemonic or the ABCs, you can say, to have a check. so that we can, manage this minutes.
So I think if you really look at these A, B, C's, and like you even said, D, E, F, these are very critical and it'll obviously help spread awareness. Dr. Agrawal, it's a common myth that only overweight individuals will develop diabetes. Are skinny people immune to type 2 diabetes?
Yes, it is a myth that only obese patient will develop diabetes or obese person will develop diabetes. In fact, non-obese person or even underweight patient can develop diabetes. It's like if you see, even like we are thinly fat Indians, even at the lower BMI, we have more of visceral fat. So though we are apparently non-obese, but we have more fat, which will lead to the insulin resistance and we can develop type 2 diabetes. And on the contrary, like the patients who are underweight or lean and thin can have the type 1 diabetes or LADA, that is insulin deficiency. So basically, even the thin patients or even the normal weight patients or the non-obese patients can have diabetes, both type 2 as well as type 1.
Okay, so we've just understood the myth that it is not that only obese people will get diabetes, even skinny people can get diabetes. On that note, we're going to be taking a short break. We'll come back more and speak a lot more to our experts. Welcome back. You're watching Beat Diabetes Myths and Facts. Dr. Chandra, I would like to start with you. What are some of the signs in the young population that one should watch out for to know in case there is any problem with the heart and may need to visit a doctor immediately?
As we know, in Indian diaspora, the younger heart attacks are pretty common these days. And one of the very important cause of this is the lifestyle changes. A lot of youngsters are into tobacco chewing or cigarette smoking. And that is perhaps the biggest cause of the premature heart attacks, besides the day-to-day stress of today's life, especially in the metropolitan cities. So if we come to the symptoms and signs, it goes without saying that one has to keep very active in their day-to-day life so as to pick up the earliest signs of heart problem like the foot angina. That would mean that if a person has been regularly walking in a park or jogging, at some point he realizes that he is unable to continue his jog, or starts feeling breathless, or there's a chest pain which is behind the breastbone, or it goes to your throat or goes to the left arm. So that could be the earliest sign where you should rush to a doctor and undergo the required test like a treadmill test or echocardiography or lipid profile check. So that is one. The second could be recurrent belching or recurrent acidity could be an indirect sign of the early heart problems, or the breathlessness, which could be an indicator of poor function of the heart, which could be digged out on doing a routine echocardiography where ejection fraction is just dropped from a normal of 55-60% to less than 50 or 45. That means he is suffering from a heart failure, which is a slow process and can eventually go to the doom. So those are some of the earliest signs and symptoms of heart problem, which one has to look out for.
Sure, and like you said, smoking is also, something we need to keep in mind. Dr. Puri, just because what Dr. Chandra was saying, we all know smoking is an important risk factor for cancer and heart disease. Can smoking also cause an increase in the risk of diabetes?
Of course, the smoking has many devastating effects, and one of them is it makes more prone towards diabetes. Now, if we compare the smokers and the non-smokers, it has been found in many studies that the smokers, they are 30 to 40% more prone to develop diabetes as compared to non-smokers. Now there are various reasons for it, like the nicotine, the main irritant that is there in the tobacco related products, that increases the insulin the resistance, it decreases its effectiveness, and that is the reason the person becomes susceptible to the type 2 diabetes especially. Another is that, because of the inflammatory actions of the nicotine, it injures cells, and then that is another cause for, making more, feasible for diabetes to mushroom up. Another is the smokers, they are very prone to have obesity. This is basically seen. And if they are not obese, even the thin persons who are smoking, they tend to have a belly fat. And central obesity is another big risk factor for, the type 2 diabetes. So these are the reasons, why the smokers, they are more, the propensity to get diabetes.
So it's not just heart disease and cancer, but also diabetes. Dr. Agrawal, can high blood sugars cause a rash? If yes, what does it indicate? Should a person just apply ointment and let it heal on its own? What can be done to avoid its occurrence?
Yes, the high blood sugar can lead to many complications, be it the involvement of the vital organs or even the involvement of skin. And as far as the rash is concerned, the rash can be something just like from an allergic rash to any indicator of any serious disease. So the suggestion should that the patient should not take it casually and just not apply an ointment and just wait for this rash to increase or decrease. Better the advice should be that every rash should be taken seriously, particularly in diabetic patients and it is on foot, because this might lead to the serious complication of diabetic foot or any ulcer. So better for any rash on anywhere in the body, the diabetic patients who are not controlled should, or even they are controlled, they should contact their physician and get it thoroughly examined so that this can be healed or corrected properly.
So not to ignore any sort of a rash, go to your doctor. Dr. Chandra, we were just talking about smoking, that it's one of the major risk factors for heart disease and of course, like Dr. Puri said, even for diabetes. So if a person who is a long-term smoker stops smoking now, will his risk of heart attack be reduced?
Oh, that's a fantastic question. As we know, cigarette smoking is the chief cause of preventable disease and death. And as was pointed out in previous answer, that there are more than 7,000 chemicals rich with toxins are inhaled with every puff of cigarette in our body. And this leads to production of carbon monoxide, which would impede the delivery of oxygen-rich blood to heart and various other body organs. It, in the long run, would lead to coronary artery disease or heart attacks or even peripheral vascular disease leading to amputations or even aneurysms in the aorta leading to rupture and sudden death. So to escape this, the best therapy is to quit smoking. And there are various programs which are developed around quitting smoking. So the earliest effects of quitting smoking will appear if within 20 minutes of quitting smoking, the heart rate and blood pressure of a person who is a smoker, this starts dropping down to normal. Going on further, after 12 hours of quitting smoking, the carbon monoxide levels would drop to normal, and thus ensuring that the oxygen-rich blood is reaching your heart and various other parts of your body. In as early as 4 years' time, the risk of a stroke becomes to the level of a non-smoker, and almost in a similar time, the risk also comes down to the heart attacks to the non-smokers level. So such are the effects of quitting smoking that you can escape heart attacks, cancers of throat, esophagus, bladder, all of them within 4 to 5 years of quitting smoking. So this is high time that the earlier you quit, better it is for your health.
Yeah, I think you've really summed that well for us. Thank you so much, Dr. Puri, Dr. Agrawal and Dr. Chandra for joining us today and sharing your expertise with our viewers. Thank you so much.